Hi, this is Myra Farhad, and my other group members include Prashant Tabaria, Raji Patel, and Riddhi Patel. We chose Middletown General Hospital Emergency Department Observation Unit analysis for our case study. For our case introduction, we want to see if a separate observation unit can be built and if it will result in any profits for the hospital. The reason for building a separate unit is because the Middletown General Hospital Emergency Department only contains about 400 inpatient beds, which are used both by patients occupying the observation status or patients who get admitted directly. Because they only have 400 inpatient beds, many of the patients end up staying in the hallway, resulting in overcrowding. This also shows that patients are not provided with enough privacy, and many times the sickest patients also end up staying in the hallway waiting to attain an inpatient bed. The director of the emergency department, Dr. Nate Green, hopes to build a separate observation unit so the most deserving patients can receive immediate care. To give a little bit of the background, let's look at their 2011 patient data. On average, the emergency department sees around 200 patients per day. Out of those 200, 50 patients stay overnight on either observation or admitted status. 80% of the patients are on admitted status, whereas 20% stay overnight on observation status. Data suggests that on average, an admitted patient stays for about 5.8 days and results in $3,500 in profits. Observation patient, on the other hand, stays on average for 1.2 days and help net the hospital $3,300. 20% of these observation patients attain admitted status and they stay for an average of 5.8 days and result in $3,500 in profits. Overall, observation beds cost much less as compared to inpatient beds, so the director wants to make sure he presents a sound economic case to the hospital administration in order for them to build a separate observation unit. This will help solve the overcrowding issue, and patients won't have to deal with any privacy concerns either. Dr. Green's estimates that it will generate around $3,700 in profits from the observation patient once the observation unit is built. The total cost for this unit will be $5 million plus $60,000 per bed. So this is an overall flow chart of the patient statistics that 200 patients are seen by the emergency department, as I mentioned before. 20% are observation patients, 80% are admitted directly. The top right section shows that observation patients stay on average for 1.2 days, netting around $3,300 per patient. 20% of those end up getting admitted for 5.8 days and result in $3,500 in profit per person. The bottom half shows that 80% patients who get admitted directly net around $3,500 in profits on an average stay of 5.8 days. So for the key questions, our main focus is to pretty much find out if building a separate observation area will be profitable for the hospital or not. To be able to achieve this answer, we focused on finding out the average census of both observation and admitted patients in 2011. This can be accomplished by considering the flow time, which will further help us understand the inventory situation better. If we know how large the observation unit needs to be to attain an 80% target utilization, we would be able to understand how much it will cost the hospital to build it. This can be achieved by using the target utilization observation percentage. To get a more accurate representation of the profit flow, we would be answering what the profit flow is on a daily basis per patient for both admitted and observation status patients. If the observation unit is built, we need to see how much we are netting per patient now as compared to what we were gaining in profits before. We want to also see if observation patients use inpatient beds, what losses is the hospital facing. If they are moved to a separate area, we would focus on if that would result in any profits. In situations when there are more observation patients present in comparison to inpatients, would this lower the overall profit of if observation patients end up using inpatient beds? We would also want to reflect on how long would it take for the hospital to make profits after the observation unit is built. If it would take a long time, it is not recommended to build a separate unit. But if it is a reasonable time period, it would be suggested to build a separate area to avoid overcrowding.
The Middletown case study is a good example of how processes and flowcharts can be used to analyze the efficiency of a series of processes and a way to suggest improvements based on that data. Little's Law is a formula that relates flow time to throughput and inventory. The law determines the average inventory in the system by multiplying throughput by flow time. This law will allow us to analyze processes, but we first need to calculate the flow time. Flow time is the time it takes the product to go through to the entire process from beginning to the end. In other words, what is the waiting total time in the queue for the unit? By determining this value, you determine how long the process takes from beginning to end, and can also help you show bottlenecks in the process. Bottlenecks are unwanted as they can slow down the process and increase flow time. An increase in flow time can cost the money as it takes longer for the product to produce something. Flow time is important because we need to know what flow time is in order to use Little's Law. Little's Law is the average of how many flow units are within the process boundaries at any point in time. Little's Law formula is inventory equals throughput times flow time. At the same time, if you know what throughput is and what inventory is, you can figure out the flow time by dividing inventory divided by throughput. Companies prefer a faster flow time as it takes less time for a product to be produced and to get through the process. The faster the flow time, the more money the company can make as the product is pushed out faster.
Part of the analysis section, we focused on finding out how much profit does the hospital make for all admitted and observation patients per day. Our findings suggest that direct admits netted around $24,138 per day in 2011, whereas observation patients netted $27,500 per day. Those being admitted after occupying the observation status result in $1,206.90 per day in profits. This means that the total profit flow was around $52,844.90 per day after taking into account all the patients with both observation and admitted patient status.
In order to find the average census of admitted patients in the hospital in 2011, we need to use Little's Law. Middletown General Hospital sees around 200 patients a day, and 50 of them stay overnight and 80% were admitted. We also need to take into account for the number of patients that were admitted directly through observations. Based on this, the flow time is 50 times 80%, which gives you 40, and then plus 50 times 20% times 20% equals 2. So the flow time here is 40 plus 2 equals 42 for admitted patients. The throughput is 5.8 for admitted patients that were admitted on average in days. In order to apply Little's Law, we need to inventory equals throughput times flow time. The inventory here is equals to 42 times 5.8 equals 243.6. So on average, there are 244 admitted patients who are within the process boundaries at any point in time. In order to find the average census of observation patients in the hospital in 2011, we need to use Little's Law. We need to figure out what the flow time is from the flowchart and use that to calculate his load law along with throughput. What we know so far is that Middletown General Hospital sees around 200 patients a day, and 50 of them stay overnight and the rest are discharged. Out of the 50 patients, 20% of them are on observation status and 80% are admitted directly. Out of the 20% of patients who are on observation status, 80% of them are discharged and 20% of them are upgraded to inpatient status. Based on that, the flow time is 50, which is a stayed overnight, times 20% observation status, times 80%. This is the number of patients that were upgraded to inpatient status equals 8. The flow is 10, but since 2 of those patients went to inpatient status, the flow time is actually 8. We are almost done here, as we know what the flow time is. Throughput over here is the observation patients that stayed in observation status for an average of 1.2 days. Now we have all the values needed to determine the inventory by applying Little's law. Inventory equals throughput times flow time, which is 1.2 times 8 equals 9.6. So on average, 9.6 observation pattern units are within process boundaries at any point in time. Using the 2011 patient flows, how large should the ED observation unit be to achieve a target utilization of 80%? In other words, what is the magic number we need to have of patients in order to achieve a target utilization of 80%? We can use the following formula for this. Target utilization observation percentage equals current incoming units for observation patients divided by the needed units observation for the new target. Well, the current unit for observation is 15 units, and X is what the value we're trying to figure out, as we know the target is 80%. So now we plug in the value in the formula, so we get 80% equals 50 divided by X. But we need to find out X. So the new formula is X equals 50 divided by 80%, and that gives us X equals 62.5. So 63 is how large the ED observation unit be in order to achieve a target utilization of 80%.
As we learned earlier, if the Middletown General Hospital wants to achieve a target utilization of 80% for the emergency department observation unit, it would need to set up 62.5 beds for the observation patients. There are 50 patients who stay overnight in the emergency department of the hospital. A target utilization of 80% means that they would like 80% of the observation unit to be occupied. This would require that there be 62.5, or more realistically, 63 beds installed in the unit. Those patients staying in the observation unit who are discharged without being admitted would result in $3,700 in average profit. So, given an observation unit of 63 units, the average total profit would be $233,100. Prior to the construction of the observation unit, the observation patients were occupying inpatient beds due to the lack of a separate observation area. The average admitted patient netted the hospital $3,500, and the average patient under observation status occupying an inpatient bed netted the hospital about $3,300 in profits. The average profit for 63 inpatients was $220,500, and the average profit for 63 observation patients in the inpatient setting was $207,900. By setting up observation patients in inpatient beds, the hospital loses out on an average of $12,600 for those 63 patients. If the 63 observation patients were set up in a separate unit, there would be an additional profit of $233,100. The calculations make the assumption that only 63 observation patients were occupying the inpatient beds. If a separate observation unit is built, it would mean that only the admitted patients would be staying in the inpatient unit. However, this may not always be the case, since it is possible that there are more observation patients than the ED observation unit can hold. Although there was a target utilization of 80%, the inflow of patients in the emergency room is highly random and can vary greatly. This would mean that some of the inpatient beds would be needed once again, resulting in reduced average profits. On the other hand, it also assumes that all the beds in the observation unit and inpatient unit are being utilized, which gives us the maximum profit possible. But there may be times when the average profit is lower than expected.
We know that the observation unit cost is $5 million plus the $60,000 per bed. 63 patients beds would be needed with a $8.78 million investment. Once the hospital sees 2,327 patients, that would be about 37 rounds of patients with who spend an average of 1.2 days at the hospital, they would begin to generate a profit from the additional emergency unit department. This would theoretically take about 45 days to cover its costs. With this analysis, it would be advisable to build the observational unit since a profit can be seen in only 45 days. It would also resolve the congestion issue, allow for a smoother flow of patients, along with providing immediate care for patients most in need. To summarize the key terms, flow time is the waiting time in a queue. The throughput is the number per unit of time. And inventory is the number of units in the process at a given time. Faster flow time would benefit the hospital because it takes less time for the patients to go through the process. Flow time is important for our analysis here because we need to know what the flow time is in order to use Little's Law. We know that the average census of how many units are within the process boundaries at any given point in time for observational patients is 9.6 and 243.6 for admitted patients based on Little's Law. This shows that the hospital will be able to generate more revenue through observation patients. Observation patients had a faster flow rate of 8 compared to that of admitted patients being 42. The hospital has enough spaces for 400 inpatient beds for observation patients and admitted patients. As we previously concluded, the hospital makes more money through observational patients. It is charging the observational patients $3,300 per day and $3,500 for admitted patients, as the observational patient flow time is faster. Out of the 50 patients that were admitted, the hospital made $25,344.90 from directly admitted patients and $27,500 from observation patients, with a total profit of $52,844.90 per day. It can be concluded that the hospital should increase their intake and see more observational patients. If the observational intake is increased by 80%, that is 62.5 patients, then they would make an average total profit of $233,100. Since the Middletown General Hospital can make more money by building the additional unit, the business case that was presented would have a turnaround rate of just about a month and a half and start making profit again after about 45 days. This exemplifies how we are able to use Little's Law to process flows, to review process, and improve on them to make money. Through this analysis, we were able to determine that Middletown General Hospital was not being fully utilized and would make a greater profit by constructing a separate observational unit since these patients were generating increased funds due to a faster flow rate.